Hey everyone, welcome back to Cosmetology Guru's study test prep for the cosmetology exam. In this video, we're going to go over 15 more questions from the cosmetology exam and go over some tips and tricks on how to remember the correct answers. So our first question, for which techniques should razors be used on curly hair? Is it blunt cuts, texturizing, feathering, or razors should not be used on curly hair? All of the answer choices refer to techniques that can be done with razors. However, the correct answer is razors should not be used on curly hair. This is because razors can cause excess frizz and uneven curl patterns. You can use process of elimination here to come to this conclusion that this is the answer, because it does not actually refer to a razor technique, since the other choices all refer to techniques, and this one is talking about the razor itself. Okay, question number 2. Dry, flaky skin and calluses can be softened during a pedicure by using antiseptic, scrubs, powder, or acetone. The correct answer is scrubs. While all the choices are products that could be used in cosmetology services, you can remember that scrubs is the correct answer because it is used to soften dry, flaky skin on the feet. And you can also associate scrubs with dryness and flakiness since you scrub off dry and flaky skin. All right, question 3. Which finger should not be used when cutting with shears? Is it thumb, ring finger, pinky, or middle finger? The correct answer is middle finger. To remember that the middle finger is not used when cutting with the shears, imagine your hand holding a pair of shears and where the fingers go. Your thumb and ring finger go in the holes, while the middle and index finger lay on top of the shears without moving. Since the index finger is not an option here, that leaves the only correct answer as middle finger. Now you may think it's the pinky, since the pinky is not used either, but the pinky does not lay on the shears at all, and the question is specifically asking about the shears. All right, all of the following are proper shampoo procedures, except work shampoo into a lather using the pads of the fingers, apply small quantities of shampoo to the hair, turn on hot water first and slowly bring down to warm temperatures. Or, when working around the hairline, protect the client's face from the spray. The correct answer is turn on hot water first and slowly bring down to warm temperatures. This is something that you should not do, because by starting off with hot water and working your way warmer, you can potentially burn the client as opposed to doing it the other way around. And this is not part of proper shampoo etiquette. Okay. If a client is injured in your salon and sheds blood, which of the following should not be done? Use a finger guard or glove to clean the client. Applicators should not be used when contacting the wound. Use liquid spray antiseptic on the wound and bandage it. Or double bag all articles used and label it with a biohazard warning. The correct answer is applicators should not be used when contacting the wound. This question is pretty tricky because they are asking what not to do, and the answer has the word not in it. So you can remember the answer to this question has the word not in it, and the question has the word not in it. Okay, our next question is, which one of the following is not one of the 7 facial types? Is it oblong, rectangular, diamond, or triangular? The answer choices to this question may all seem right since they are all shapes. However, the correct answer is rectangular, because rectangular is not one of the 7 facial types that we discuss in cosmetology school. The best way to remember this and any other question involving facial shapes is to envision the shape that the question is asking. Imagine it in your head. And when you imagine a rectangle, it's hard to imagine it as a face because rectangular is not a facial type. There is a distinct difference between sheen and shine. Shine has all of the following attributes except brighter than shine, looks good with a hair glosser, softer glimmer, or scattered throughout the hair. Sheen and shine both describe the way light reflects off the hair, and the answer choices are confusing. The correct answer, though, is brighter than shine, because sheen is not brighter than shine. The best way to memorize this is to remember the phrase, sheen shines less than shine, to help you remember that sheen is less than shine. All right. Which of the following is not a type of conditioner? Is it rinse out conditioner, repair conditioner, dry conditioner, or leave-in conditioner? All of the choices have the word conditioner in it, but the correct answer is dry conditioner. This is because dry conditioners are not a type of product at all. There are dry shampoos, but there are not dry conditioners. Okay, next question. Which of the following describes a pear or triangular face shape? Is it narrow forehead, wide jaw, and chin line? Wide at the temples, narrow at the middle third of the face, and squared off at the jaw? Wide forehead and narrow chin, or long, narrow face with hollow cheeks? The correct answer is narrow forehead, wide jaw, and chin line. The best way to remember this is by envisioning a triangle, which is narrow at the top or at the forehead and wider at the bottom or the jaw and chin. When a sulfur atom is removed from a disulfide bond, the bond is converted into which of the following? Oxygenation bond, hydrogen bond, salt bond, or lanthanide bond? This question is tough because all of the answers have the word bond in it. But to start, we can immediately rule out oxidation bond because this is not a type of bond at all. Oxidation is a process, is a process but not a bond. This leaves us with salt bond, hydrogen bond, and lanthanide bond. Hydrogen bonds and salt bonds are the two weakest bonds of the hair that can be broken, followed by a disulfide bond, which is the strongest. The question is specifically asking about disulfide bonds, which means the answer can't be hydrogen or salt bond, since these three are all separate types of bonds. By process of elimination, this leaves us with the correct answer, lanthanide bond. Many clients may be infected with HIV without having any of the following: blood tests, sexual contact, sharing blood with others, or potential symptoms. The correct answer to this question is potential symptoms. We can rule out these first three choices because these are all possible ways that HIV may be transmitted, and the question is asking about having something such as a symptom, because we have symptoms. You can remember this because in English we say, you have a symptom, or I have a symptom, and the question has the word have in it. Soft water is preferable to hard water for shampooing because it works up a better lather, feels softer on the client's skin, holds its temperature better, or leaves an attractive residue behind. We can immediately rule out the last two answers. It's not holds its temperature better because hard and soft water don't have different temperatures. We also know it leaves an attractive residue behind because there is no situation in which we want to leave a residue behind on the hair after shampooing. That defeats the purpose of shampooing. This leaves two options: works up a better lather or feels softer on the client's skin. The correct answer is works up a better lather. You can remember it's this one and not feel softer on the client's skin, because when shampooing the hair, you should not be touching the client's skin at all. Which elevation angle could be used, to add weight to a haircut? Is it 90 degrees, 45 degrees, no elevation should be used, or 100 degrees? So this question is kind of tricky, and the correct answer is 45 degrees. You may think the answer is no elevation should be used. However, the question is specifically asking about an elevation angle, which means the answer must be one of the three choices, including degrees, and degrees refer to angles. Using a higher angle in general removes more weight from the hair, which means the answer must be the choice with the lowest degree, since it's asking which angle can add weight, not remove it. This means the answer is 45 degrees, since 45 degrees is the lowest angle choice. Which type of infection affects one area on or in the body? Organic infection, broad spectrum infection, local infection, or general infection? The correct answer is local infection. We can rule out organic and broad spectrum infection, as these are not types of infections to begin with, which leaves local and general infections. You can remember that it's a local infection and not general, because the word general means all over, common, or widespread, indicating all over the body. And the question is asking which infection affects one area. All right, our last question is, which layer of skin produces the cells that color the skin? Is it granular, basal cell, spiny, or horny? The correct answer is basal cell. You can remember this by remembering that the color of the skin comes from the base or basal layer of the skin. For more study questions, you can try our free practice test on cosmetologyguru.com and test your knowledge. And we also have a full online study package that can be found at cosmetologyguru.com. Thanks for watching.